Mistakes can be devastating, but some can be fatal. 17-year-old Jesica Santillan's life depended on a heart transplant, a complex procedure. Born with a rare heart condition, she and her family had faced years of uncertainty, crossing borders from Mexico to the United States in search of a cure. After a long and difficult journey, a donor was finally found. But a tragic mistake during the transplant changed everything. A young life was cut short by a mistake that could have been easily prevented. Let's take a closer look at Jesica's journey and the events that led to this devastating outcome. Jesica Santillan was born on December 26, 1985, in a small, rural town near Guadalajara, Mexico. It was a town surrounded by lush green fields and vibrant community life. Her parents, Melico Huerta and Magdalena Santillan, welcomed their little one with joy, but their happiness was short-lived. From birth, Jesica struggled with severe health issues, including vomiting blood on her first night home, which could have led to dehydration, electrolyte imbalances, and even organ damage. Frequent, debilitating headaches as a young child may have caused her to become lethargic, irritable, and unable to thrive. Her parents were consumed by fear as they watched their sweet daughter suffer. It was a suffering that would only intensify as the years went by. Despite initial misdiagnoses, Jesica's condition worsened, and at age 5, her parents took her to Victoria, Texas, in search of answers. There, an American doctor finally identified the root cause: restrictive cardiomyopathy. This was a life-threatening heart condition where the heart muscle becomes rigid and unable to fill with enough blood, leading to inadequate oxygen supply to the body's organs and tissues. This diagnosis set her family on a desperate search for a cure. Jesica's family, who didn't speak English, decided to travel to the U.S. to get treatment for her. Magdalena Santillan's sister, who lived in Lewisburg, North Carolina, had told Santillan that Duke Medical Center could help. The Santillans paid a hefty sum of $5,000 to a smuggler to move the whole family, including Jesica's brother, Ulises, and sister, Dulcie, across the border. Relatives have stated that the family paid a coyote to get them across the border. A coyote is a person or group that smuggles individuals across international borders, often for a fee, using invasive methods to avoid law enforcement. Unfortunately, while they were traveling through the Sonoran Desert, thieves stole all of the family's money. When they arrived in Lewisburg, Melico obtained employment as a construction worker. Meanwhile, Magdalena took a job as a housekeeper for Lewisburg College. The family settled in Durham, North Carolina, near Duke University Hospital. Meanwhile, Jesica's condition continued to worsen. Her family's worries deepened. She developed pulmonary hypertension and was short of breath when exerting herself. A simple task became a struggle. In spring 2000, doctors recommended a heart-lung transplant, but the cost was staggering: $500,000. The family couldn't afford it, and to make matters worse, they didn't qualify for Medicaid due to their illegal immigrant status. They decided to take matters into their own hands. The family began raising money with local churches and civic groups, and a community came together in support. Mac Mahoney, a Lewisburg home builder, befriended the family and spent tens of thousands of dollars on Jesica's heart surgeries, a generous act that gave them hope. He also established Jesica's Hope Chest, a nonprofit foundation, to help raise money for her medical bills. In May 2002, Jesica's doctors placed her on the waiting list for a heart-lung transplant, and then the long wait began. Finally, on February 6, 2003, the Santillans got the call they had been waiting for. A matching donor had been found, and Jesica's transplant was scheduled. Jesica's first transplant surgery began on February 7, 2003, at Duke University Hospital. The new heart and lungs had been flown in from Boston, and the surgical team, led by Dr. James Jaggers, the chief of pediatric cardiac surgery, worked to implant them. Dr. Jaggers, a highly regarded surgeon with over 100 heart transplants under his belt, had performed the operation flawlessly. But a devastating mistake was about to unfold. As the surgery neared its end, a lab technician called Dr. Jaggers with alarming news. Jesica's blood type, O positive, didn't match the blood type of her new organs, which were type A. Dr. Jaggers was stunned, recalling that everything had seemed to be going smoothly until that moment. The discovery was made too late, and Jesica's immune system began attacking the new organs. Dr. Jaggers felt a deep sense of helplessness, knowing that the mistake was irreversible. He described it as a death and dying reaction, a feeling of utter despair. The outcome was devastating. Jesica's immune system rejected the transplanted organs, leading to catastrophic consequences. She experienced a series of severe medical crises, including seizures, heart attacks, and kidney failure. Despite the transplant team's efforts to prevent rejection using immunosuppressant drugs and plasmapheresis, her condition deteriorated rapidly. Her body began to shut down, and the hospital quickly alerted the United Network for Organ Sharing, UNOS. Dr. Jaggers had to break the news to Jessica's family, explaining that the organs were incompatible and that it was a grave error. He took full responsibility for the mistake, acknowledging that it was a result of a breakdown in communication. The mistake was a result of a failure to cross-check Jessica's blood type with the donors. Dr. Jaggers noted that such a basic error should have been caught earlier, and that it was a devastating oversight. Ralph Snyderman, Chancellor for Health Affairs at Duke Hospital, also acknowledged the error, attributing it to a lack of redundant checks. Just a short time ago, Jessica's was on the brink of a medical miracle, but now her life hangs in the balance. Duke University Health System promised to correct the error by attempting to acquire a new heart and lungs for Jessica. As soon as the mistake was discovered, Jessica was placed on the organ donation list. However, her chances of receiving a second set of organs quickly enough were extremely low. With only 28 heart-lung transplants performed in the U.S. in 2002 and around 200 patients waiting. Despite these odds, a rare opportunity arose and a second transplant was performed on February 20th with organs of the correct blood type. Unfortunately, Jessica developed severe complications, including brain swelling and kidney failure. The second transplant was made possible through normal channels, despite the publicity surrounding Jessica's case. Tragically, all efforts to save Jessica proved to be unsuccessful. She was declared brain dead on February 22nd, and her heart stopped beating at 5:07 p.m. She was removed from life support at 5:10 p.m. The case highlighted issues with the organ transplant system and the ethics of risky second transplant operations. Duke University Hospital acknowledged human error and a lack of safeguards. The hospital's spokesman, Richard A. Puff, stated that the hospital had taken steps to prevent similar mistakes in the future, including requiring 3 crucial members of the transplant team to confirm the blood type match. An investigation revealed a series of mistakes, including the failure of Carolina Donor Services to confirm the recipient's blood type, despite their internal policy requiring it. Dr. Hill, who retrieved the organs, was not informed of Jessica's blood type, and blood typing tests were not completed before the organs were implanted. The family and their supporters were critical of the hospital's handling of the situation, with Mac Mahoney, a family friend, accusing Duke of trying to cover up the mistake. The hospital's actions and decisions have been scrutinized, and the case has raised important questions about medical ethics and accountability. Duke University Health System reached a settlement. The agreement, announced by Dr. William J. Fulkerson, CEO of Duke University Hospital, was sealed and its terms remain confidential. Fulkerson stated that the settlement was fair and equitable for both parties. Jessica's mother, Magdalena, expressed relief tinged with grief, saying she couldn't be happy without her daughter. Entire hopes and dreams were extinguished as Jessica's life succumbed to a devastating medical error. This heart-wrenching case underscores the importance of meticulous attention to detail and robust safety protocols in medical procedures to prevent such tragic errors from occurring. May her memory live on and inspire changes in medical protocols to prevent such tragedies from happening again.